In movies and television, a first sexual encounter is almost always depicted as flawless. The lighting is soft, the timing is impeccable, and the physical mechanics seem to work effortlessly without a single word of instruction. The reality outside of those cinematic portrayals is highly contradictory. Society places immense pressure on young people, demanding adherence to rigid concepts of purity while simultaneously treating extreme physical pain as a mandatory, unavoidable rite of passage. Operating on these fictional scripts creates immediate physiological risks. Unplanned pregnancies, viral infections, and deep psychological distress frequently occur when individuals step into a highly vulnerable physical situation completely unprepared. To ensure actual safety, we need to strip away the cultural guilt and the impossible media standards. We have to examine the exact biological science of the human body. Stepping into a sexual encounter without a clear understanding of human anatomy directly compromises your physical safety and well-being. The most persistent anatomical misunderstanding revolves around a single expectation: that a woman must bleed during her first sexual encounter to prove her virginity. This 3D model shows the hymen is a thin, flexible tissue partially covering the vaginal opening. Many females are born with a complete natural absence. When present, it stretches smoothly and can easily tear from everyday non-sexual activities like sports. Because of this high structural variance and natural elasticity, bleeding is absolutely not a reliable biological indicator of virginity. The traditional physical purity test has no basis in human anatomy. Going into an encounter expecting intense pain or worrying about performing perfectly triggers a severe physiological stress response in the brain. This cross-section illustrates how that sudden stress affects the female body. High anxiety sends rapid signals to the pelvic floor, causing the vaginal muscles to involuntarily tighten and spasm, a highly painful medical condition known as vaginismus. The male nervous system reacts similarly to immense psychological pressure. High anxiety directly disrupts arousal, frequently causing premature ejaculation or erectile dysfunction. To prevent these stress responses, the body requires physical and chemical preparation. Extensive foreplay is a biological requirement to increase vital blood flow to the genital tissues, expanding the local blood vessels to enhance both sensitivity and natural lubrication. This neurological model of the brain shows what happens when partners establish open communication and emotional trust. The brain releases a massive flood of oxytocin to reduce stress, along with endorphins which travel down the nervous system to block pain receptors. Experiencing physical comfort during a first encounter is the direct mechanical result of this chemical preparation. Emotional safety allows the body to bypass the natural stress response. Even with optimal chemical preparation, a high adrenaline first encounter can disrupt the body's ability to produce sufficient moisture, creating problematic physical friction between delicate anatomical structures. Applying a synthetic, water-based lubricant reduces this surface friction. This simple addition prevents painful micro-tears in the tissue, keeping the physical mechanics running smoothly. Beyond physical friction, there is the immediate reality of pathogens and human reproduction. A highly persistent misconception suggests you cannot contract a disease or conceive a child on your first attempt. This statistical visualization demonstrates the exact opposite. As the chart shows, the risk factor for viral transmission and fertilization remains high. Both outcomes are entirely possible from the very first encounter. Stating a clear desire to use a condom is frequently portrayed in media as an awkward interruption. In reality, it acts as a biological shield against these immediate, life-altering threats. Utilizing physical protection and synthetic lubricants provides a scientifically proven safeguard for your cellular health. It protects your future without detracting from the intimacy of the moment. Real life looks more like this. A healthy first-time encounter is a biological learning process. It is frequently awkward, occasionally clumsy, and completely acceptable. Experiencing logistical imperfections, whether that means stopping halfway through or losing an erection, is simply the reality of a human body adapting to a highly unfamiliar physiological experience. Actively verbalizing your boundaries and ignoring impossible media expectations are the most effective strategies for maintaining your physical and emotional safety. When you replace myths with a clear understanding of your own anatomy, you gain control over your physical well-being. This knowledge acts as a practical safeguard, providing a foundation for sexual health based on evidence rather than anxiety.